Well, hello to everybody out there today. My name is Dr. David Nebbeling with Advanced Osteopathic Health here in Lansing, Michigan, where we specialize in regenerative medicine. And I have to say, when it comes to all the tools we have available in our toolbox here, there probably is no treatment more impressive or powerful than platelet-rich plasma, or PRP as it's oftentimes abbreviated. And I'm not just saying this as a physician who's provided PRP to countless patients with remarkable benefits, but actually as a patient myself. And to explain a little further, I like to live an active lifestyle, and I actually dislocated my right shoulder about 3 years ago. And for those of you that have never dislocated a joint or a shoulder, God bless you, it's a terrible experience. And what it left me with was chronic right shoulder pain and instability, as well as just apprehension. Anytime I used it, just worrying it's going to dislocate again or I'm going to injure it again. And although it may come as a shock, or it may be funny people out there, I'm actually not a big fan of doctors or needles myself, so I put off treatment for a while. And just within the past year, I finally came to my senses and I got treatment actually with platelet-rich plasma. And within 6 weeks, I started noticing benefit in this shoulder. And now, a few months to a year later, this is actually my good shoulder when compared to the other side. So what I thought I would do today is to take you guys behind the scenes into the lab in our office to answer some of the most frequently asked questions we get about PRP. Obviously, the first question we get is, what is PRP? So as we said before, that stands for platelet-rich plasma. And what that is it's a regenerative medicine technique, sometimes called a biologic technique because it comes from the patient's own body. So this can be something extracted from the patient, re-injected into a site of injury, which stimulates the healing cascade and repair of a damaged joint. To demonstrate a little further, I agreed to be a guinea pig today, and I had one of our phlebotomists do a blood draw on me for today's video. And although some people consider phlebotomists vampires, I just call ours Jen because she does a great job and she makes this a very quick and painless process. So Jen drew about 50 cc's of blood off me, which isn't a terrible amount. And then that blood can be placed within a centrifuge here in our office. Now that centrifuge spins very fast and it separates the blood based on the density of its components. So what we end up getting is a separated blood sample. Now we can see here at the bottom we have red blood cells, and then up top we have the plasma, and then in the middle there's something called the buffy coat, which contains concentrated platelets and growth factors. We're able to draw off that platelet-rich plasma, and one of the cool things we're able to do in our office is actually microscopically validate the samples that we do to make sure that you're getting the appropriate concentration of platelets, which we know is really just vital to a therapeutic treatment. So at the end of all of this, what we get is platelet-rich plasma, a small amount here in a syringe, and that can then be re-injected into a site of injury, such as maybe a knee that has osteoarthritis, or a torn ACL. But it doesn't have to be that. It could also be a bad back, a bad shoulder, a bad hip. So I think the next question we get is, what to expect after treatment. So I'm not going to lie to you, it can be a little uncomfortable after a treatment, and we do provide patients with probably about 2 to 3 days of a pain medication, although most of our patients do just fine with Tylenol. After about that 2 to 3 day period, most patients are feeling back to normal and they start to notice benefits within 6 weeks. So if you'd like to know more about platelet-rich plasma specifically, or regenerative medicine and non-surgical joint pain relief options, feel free to follow us on YouTube or Facebook, or reach out to us at our website at advancedosteopathichealth.com. And don't ever be afraid to just give us a ring. We love talking with people about what we do here.